All right, now we're going into this should actually be chapters 1 and 2, working in long-term care, which is where we'll be doing our clinicals at long-term care. First slide here talks about that your focus is the resident, the person needing care. You must provide quality care and promote the person's quality of life and independence. What they mean by this is that a lot of your residents in the nursing home are coming from their home and they are trying to adapt to a whole different environment, and it is very hard for them. You try to give them as much leeway as possible to do as much as they can for themselves. For instance, you're going to notice when we go and do our clinicals, if you're feeding someone, it's going to take, you're going to have to let them do as much of it as possible, and you might want to just grab the spoon from them and feed them, but you need to let them be as independent as possible. Let them comb their hair, and if it's wild and crazy, it's wild and crazy. They did it themselves. Like it says, independence means not relying on or requiring care from others. Long-term care center, that's where we're going to, a nursing home. They provide health care to persons who cannot care for themselves at home, but do not need hospital care. So when we're in the long-term care facility, you're not going to see like necessarily IV bags hanging. You're not going to see surgeries occurring. It's not that hospital environment, but you're going to see that the daily needs of life are taken care of. They're going to get their food. They're going to get groomed. They're going to get socialization and interaction. Let's say that I am a 90-year-old man whose wife passed away. I've never cooked a home meal. I've never done my own laundry. But I'm pretty with it, but I might need some help. Then I could go into a board or care home. It's a residential care facility. It provides a room, a meal, and laundry, but it's a home-like setting. Another place that I could go to is an assisted living facility. There's housing there. They do provide personal care, support services, health care, and activities, but again, it's like a home setting. When we are looking at the nursing home, what you're going to see around you. The nurses are required to be licensed. Every year I pay $50 and I get my license renewed. That shows that I've been checked through an abuse registry, that I haven't had any malpractice against me, that I have done the obligations that I'm required to do in order to renew my license. They will check and make sure all of your licenses are on file. You have to provide that every year or they'll take you off the schedule. They might fire you. Skilled nursing facilities. When we go to our clinicals, half the nursing home is skilled, half the nursing home is a long-term care facility. Let's say that I had a hip replacement and I only need to be somewhere for like 30 days. I might need somebody to come in and do some rehabilitation with me. I might need to go to physical therapy. But initially while I'm healing from that hip replacement, I can't cook my own meals. I need help going to the bathroom. That's what the skilled nursing facility is. So where we're going, you're going to work on that kind of unit also. All right. It says nursing center organization, usually owned by a corporation. Each center has an administrator, and then there will be people underneath them reporting to them as to what's happening in the nursing home. They have to have a medical director. You'll have somebody that's a director of nursing. A director of nursing is a nurse. They've done what you're doing. They've worked their way up to become a director of nursing. You can't go to school and just say, I want to become a director of nursing and never do any nursing beforehand. They are over all of the nurses. And then you have managers that will be over each unit. I'll show the next slide. I'll show you the hierarchy, but it goes from director of nursing down to nurse manager, down to an RN, down to an LPN. It says you report to the nurse supervising your work. So you guys as CNAs are going to report to either an LPN and an RN, whoever you are assigned to. In your clinicals, you're reporting to your CNA, but they're with you the whole time. No worries there. It says nursing education staff development as part of nursing science. There's 3 hours that we're going to go to the nursing home that you're not going to have any contact with any patients, that you're going to sit and be educated on the elements of the nursing home and about infection control and different procedures, and they're going to take you on a tour. That's the nursing education staff. There's the organization chart. Shows you that director of nursing goes down to nurse manager, charge nurse, staff RN, and LPN. All of you all keep asking me, like, oh, the lights just went out. Hang on. I have to make a movement for them to come back on. All right. You keep on asking me, like, what's an RN? Okay. If you go to school to become a nurse, you could go to a 1-year program and become a licensed practical nurse. That is not a degree. A licensed practical nurse has a licensing, and their scope of practice, meaning what they're allowed to do by the state of Kentucky, is limited to specific things. Like, they can't actually take a medication and put it into an IV line. They can't actually do like what's called an arterial stick and actually stick into an artery and draw blood out of it. They can't start a blood transfusion on their own. All of those specifics are outlined on the Board of Nursing website. So maybe I want to get my nursing degree as quick as possible. I could become an LPN. I was an LPN. And then you could go work in a place, and they would help you to achieve further education if you would like. An RN, okay, as an LPN, I went to school for a year. Am I an LPN? No. I have to go sit for a test. And once I take the test, it's called the NCLEX PN, then I can become licensed. When I become an RN, I can either go to an associate's degree, which is 2 years. I can go to a bachelor's degree, which is 4 years. When I graduate from that program, am I a nurse? No. I have to go sit for the NCLEX, a test. If I pass that test, then I can get my registration as a nurse. All right? That's what an RN is. It doesn't mean the amount of education they have. They could have a 2-year degree, or they could have a 4-year degree. It means that they were able to sit for the certification process and get their registration as a nurse. All right. And then why do you go back then and why wouldn't I just get a 2-year degree? Why would I go ahead and go get a 4-year degree? Because it allows you to move up on this. As you see this organizational chart, it allows you to move up. Now I want to become the nurse manager. You cannot move up into management unless you go up further in your education and become bachelor's or master's. All right. There's your nursing team made up of RNs, LPNs, nursing assistants. They work in a team environment together to take care of the patients. This talks about different nursing care patterns, and it depends on, like it says, how many persons need care, the staff, and the cost. When you get into nursing, you'll realize that based upon the number of patients in the facility is how much nursing staff is needed. And so it does help to develop how they give that care. In an intensive care unit like I worked in, it's a lower ratio. Sometimes I would report into work and it would be 1 nurse to 1 patient. But let's say I am working in a long-term care facility, and those aren't intensive care patients. They are more of those daily needs. Then I might have a patient ratio of 8 or 10 to 1 nurse. So these kind of get into different types of care patterns. I'm going to skip this right here. On your worksheets, you'll see that you are matching up to see the different types of professions that are in a long-term care facility. This is why the clinicals are great, because you'll see the physical therapist, you'll see the social worker, you'll see the dietitian, you'll meet all these people, and it'll bring it all together as to how they all collectively as a group provide care to our patients. How is it paid for? I want you to get in your head now the difference between Medicare and Medicaid. Every single one of us in here in this room, when we get to an age, on this PowerPoint it says 65. I need to go look at that because I believe they raised the age to 67. Although this book says 65, I believe. But we are all eligible for Medicare when we reach that age. A federal health insurance program. Get in your head that Medicare is federal. Medicare is federal. Everybody gets it. Okay? Medicaid means I need aid. I need help. Not everybody is eligible for Medicaid. It's only those that are in need. Medicaid is by the state. Medicaid state. If you think that rhymes, I think it rhymes. That's what I work with. Aid, Medicaid, I need aid, and it comes from the state. Okay, so maybe you're on, you need help with your health care and you guys are on Passport. That would be a Medicaid program. Not everybody is eligible for that. Only a certain amount of benefits are offered through Medicare. Like when my grandmother was in the nursing home, Medicare was to a certain point, and then Medicaid kicked in because we exhausted all of the benefits of Medicare, and then we needed aid. Medicaid kicked in. Different per state also. I might flip over to Indiana and it'll have different elements to Medicaid than it does here in Kentucky. Medicare is federal, so it's across the board. This says prospective payment systems. I'm not going to go too much into those, but you probably saw those on your worksheets. The Omnibus Budget Reconciliation Act of 1987. This, you will be tested on this. This will be in your test. This is the most important thing about this program because of this act. OBRA is why there is a certification process for nurse assistants. It is a federal law that applies to all 50 states, and resident rights are a major part of OBRA. So back in the day, they used to abuse people. You know, they used to, that patient would get up and wander around. We don't want them to. We're going to tie them to a chair. It's easier if I close the door so they can't get out. You know, different means that resulted in patients' rights being violated and in them feeling restrained. So that's where OBRA came in and said we have to treat people like people. So it says residents' rights. Residents have rights as United States citizens relating to their everyday lives and care in a nursing center. So nursing centers must inform residents of their rights. I have to tell you that you have the right to refuse. The next page will tell you everything you have the right to. But I have to provide it to you orally and in writing before or during admission to the center and in the language the person uses and understands. If they speak some language you don't know, it is their right that they get that information in their language and you go find a language interpreter. They will have those services available for you. Now it's a lot easier. It's all over the phone and stuff. All right, so that you have the right to information. When I want my chart, I have the right to it. I can't see the actual chart. I have to put it into a request and then they give me a printed out version of it. I can refuse treatment. I have the right to my privacy and confidentiality. Not everybody out there needs to know what's going on with me. I have the right to personal choice. If I don't like mashed potatoes, you can't make me eat mashed potatoes. I love mashed potatoes. You can voice disputes and grievances. Take part in resident and family groups. So if they want me to go participate in the sing-along and I hate to sing, they can't make me go. Care and security of personal items. I can have my own personal items and they should be respected. When you go into the nursing home, you'll notice they have their blankies and they have pictures. They also have money. And in the past, these poor little people were ripped off, stolen from, and these OBRA came in to protect them. So they have freedom from abuse, mistreatment, and neglect, freedom from restraint, and quality of life. They need to promote my dignity, my self-esteem. They need to provide activity programs. I need to have a quality of life, and it needs to make me feel like I'm in a home, a home-like atmosphere. Ombudsman, remember, ombudsman, the middle part says bud, I think of buddy. An ombudsman is my buddy, and you guys could put it to your counselor here at school. They're employed by a state agency, they act on behalf of the nursing center, and they protect the residents. All right. The last note, accreditation, I probably am not going to make it onto this PowerPoint. I'll talk about later.